Hey, it's Michael Smerconish. Welcome back to the program. What an honor for me to welcome in studio the former governor of the great state of Kansas, the Secretary of the Department of Health and Human Services, and I think unquestionably the nation's highest-ranking health official, Kathleen Sebelius. Madam Secretary, thanks for being here. I really appreciate your time.
Great to be with you, Michael. Thanks.
I can remember you wouldn't recall this, but I remember your maiden voyage with me by now 2 or so years ago, and I was flummoxed by the pronunciation of your name. I think I said we have Governor Sebelius coming up. Everybody certainly knows your name now.
Well, you were correct in the pronunciation. That's how the musician pronounces his name, Jan Sebelius. So
there you go. Any relation?
My husband's family says there's a connection. My husband's family is Swedish, and Sebelius actually was Finnish, but somewhere back in the old country.
You know, there's a great ancestry program on NBC these days where they're taking famous people and tracing their genealogy. You could be in that category.
Well, might have to do that.
Matthew Broderick and Kathleen Sebelius. I want to give an overview with your assistance. I mean, who better to ask about some of the misconceptions that surround the bill and some of the truths that people need to recognize about the bill. But allow me to begin by asking, because we're all familiar with the phased-in nature of the health care package, what happens this year?
Well, Michael, there's some pretty important features that kick in right away for small business owners who often are paying substantially more for their insurance than our larger employers because they don't have any bargaining power in the marketplace. There's a tax credit that kicks in for 2010 to help them purchase health insurance for their employees. So people need to check that out right away because it's a 2010 feature. Parents who have children with some kind of health condition, cancer survivors, asthmatics, often had trouble getting coverage for those kids altogether or getting the treatments that the children needed covered by insurance. That changes this year. Children with pre-existing conditions will be covered by their parents' insurance policies. Parents who have kids who are going into the job market who are either aged out of a policy, often it's 21, 22, or graduating from college, which was often the extender, and had to worry about what happened to their kids this year. Those kids can start staying on parents' policies up until the age of 26. A big relief for lots of families where they don't have to have their kids graduate, yay, but lose their insurance coverage. Seniors this year will get some help with their prescription drug coverage. Over the time of the bill, the so-called donut hole will be closed, but this year they actually get a check in the mail to help pay for prescriptions. And preventive care is covered by policies this year without a copay, encouraging people to get the screenings they need to get early intervention. So all those features actually hit right away.
Sooner rather than later.
You bet.
The St. Petersburg Times has a website. They call it PolitiFact, and they spent a tremendous amount of time researching the health care bill and trying to sort out fact from fiction. I have a top 10 list.
Okay.
This is their list, and I'd love to run it by Secretary Sebelius. The top 10 facts that they say you need to know about health care reform. Number one, the plan is not a government takeover of health care as in Canada or Britain.
That's absolutely true. It's a private market strategy. The new marketplace that will kick in by 2014 is actually private companies offering insurance with new rules and new purchasing pools. So it is not a government takeover of anything.
Insurance companies will be regulated more heavily.
I think that's true. It starts at the state level. Here in Pennsylvania, you have an insurance commissioner. States around the country, I used to be an insurance commissioner. So we start with the assumption that the regulation is best on the ground, and then the federal government provides a backup. What our role really is some transparency. Insurance companies will have to give us data. We'll have it up on the website. Folks will be able to understand a little bit more about why rates are going up, and they'll have to live up to what's called a medical loss ratio, making sure that 75, 80, 85% of the premiums they get in are actually spent on healthcare costs, not CEO salaries and overhead.
Let me ask Secretary Sebelius to draw on your experience as insurance commissioner for the state of Kansas and comment on the attorneys general. I think it's 13 or 14 of them now, including in my home state and many of the states that I reach, who have joined in this lawsuit initiated from Florida saying on constitutional grounds that this health care proposal should not move forward. What's your take on that?
Well, our legal counsel and consultation with the Justice Department team, feels that the bill is on very strong constitutional grounds, first of all, and so they'll vigorously defend the suit. And as you know, there are attorneys general who have actually joined the other side defending the suit. Many of the attorneys general who have brought a case are also positioning for higher office, and one could suggest this may have a little bit more to do with politics than actually constitutional policy. Having said that, in a state like Pennsylvania, which is having the same kind of budget troubles that every state in the country is having, Pennsylvania is actually a net winner under this bill. There will be more assistance for the federal government for health insurance that you're currently providing, lower costs because you won't be paying for uncompensated care. So over the course of time, Pennsylvania as a state will actually net more than will be expanded under this bill.
How about the argument, Governor Romney was here yesterday. He was a telephone guest of mine. We had a good substantive conversation about the health care bill, and he was making the case that this would be far better if it were bottom-up, meaning state-initiated, as opposed to top-down, federal government imposed on the states. Why is that not a practical solution?
Well, as you know, Massachusetts and the bill signed by Governor Romney provided a template for the bill considered at the federal level.
He doesn't say that.
Well,
it's not what he said yesterday.
It's interesting, but the features of the bill compared side by side are very, very similar.
Did you study Massachusetts as
absolutely,
part of your work?
Absolutely. We took a careful look at it, talked to, the one thing that the Massachusetts folks told us, and particularly the business leaders who were part of the discussion, is they said they made a mistake. And the mistake they made was to try and do this as a two-step plan. Step one was getting everybody covered. Step two, which they're doing right now, is to try and look at some cost containment, cost controls, which is one of the reasons that we wanted to make sure they were both part of this package from the outset, learning from the Massachusetts lesson. But I think what the governor will tell you now in Massachusetts, others will tell you, it's very difficult to control costs, to change a healthcare system a state at a time. States have definitely been the innovators in this area. Lots of them are doing very creative things, but I think the feeling was that if we really want to begin to transform the entire healthcare system, lower costs for everyone, drive prevention and wellness, really crack down on fraud and abuse, you really needed a national strategy.
What I said to the governor yesterday, and I think this is worth mentioning because it's a way to also educate as to what this bill is and is not, both represent state action that is bringing about insuring more Americans. Both provide universal coverage, both utilize exchanges, both do not have an opt-out provision, and each provides a subsidy for those who lack health insurance. Those would seem to me to be the similarities, and I read his book and read a great deal about the subject. When I said that, Governor Romney said, true, but ours didn't raise taxes, and ours was state action, not federal action.
Well, I would agree that it was state action, not federal action. I think that there's a lot of disagreement about the tax issue. In fact, Massachusetts started with a much more generous base of Medicaid support than the federal bill contemplates going forward. But I think the features that you named, in addition, Massachusetts has an individual mandate, has a belief that everybody needs to be responsible, be part of the system.